Good afternoon, ladies and gentlemen. I'm Jaime Estrada, Dr. Jaime Estrada. I'm the chair of the National Hispanic Medical Association, San Antonio Chapter, and president of Texas Doctors for Social Responsibility. I would like to welcome you to the 2020 NHMA Texas Chapter Summit. Our topic this afternoon is the impact of COVID-19 on border communities. It is an honor for me to introduce my colleagues and moderators for this session, Dr. Bert Johansson, Chair of El Paso Chapter, and Dr. Francisco Fernandez, Chair of the Rio Grande Valley Chapter. Dr. Fernandez?
Thank you, Dr. Estrada. I am deeply grateful to you for the opportunity to be able to participate and would like to begin by introducing the panelists of some of the panelists, and Dr. Johansson will interview the next set. The first panelist will be Mr. Eduardo Olivares, who's the Chief Administrative Officer for Idaho County Health and Human Services. Our second panelist will be Paula Gomez, who is the Executive Director of the Brownsville Community Health Center. And then Dr. Alfonso Mercado, who is Associate Professor of both the Department of Psychology and Psychiatry, as well as the head of the Multicultural Research Laboratory at the University of Texas, Rio Grande Valley. Dr. Johansson?
Unmute.
Yeah, thank you for having me be involved in all of this. It is my honor to introduce Ms. Hannah Hollenberg, who is a member and a policy member of the Hope Border Institute. She'll be speaking as well as being part of our panel. She's one of the strong young Latina voices coming from the border and has a lot to say that is based in fact, as well as in taking care of our own people. It also gives me great pleasure to say that His Excellency, the Most Reverend Mark Sykes, Bishop of El Paso, is here. And Bishop, you helped me be a better Catholic. You may not know this, but once I attended your Mass on the border, yo tengo el Espíritu Santo dentro de mi corazón. So gracias, mi hermano. Otra vez.
Thank you, Dr. Johansson. It is now my great honor to be able to introduce our next speaker, who will be giving welcoming remarks. And that is Dr. Helena Rios. Dr. Rios has been the most incredible, enthusiastic, committed, passionate, and one of the most energetic people that I know, who has been, even since she was a medical student at UCLA, has been trying to do the best always on behalf of Hispanic health. Now she is, since 1998, I should say, she's been president and CEO of the National Hispanic Medical Association, of which she's going to tell us a few words about today. So welcome, Dr. Rios.
Thank you. And thank you, Dr. Estrada, Dr. Fernandez, and Dr. Johansson. I just wanted to welcome everyone and tell you a little about the National Hispanic Medical Association's current advocacy work on COVID-19. We're going to hear about the border, which is very, very important, but I need to tell you, in Washington, D.C., we have been part of the U.S. Department of Health and Human Services vaccine consultancy group with the Office of the Secretary and the Assistant Secretary, and we are here to encourage all of you to tell your patients and colleagues to consider enrolling in the clinical trials for the vaccine for COVID-19. There are probably a dozen companies that are involved with at some stage of research, but I bring you two different clinical trials. The one from the National Institutes of Health with Moderna is the first URL here, coronaviruspreventionnetwork.org. And the second URL is covidvaccinestudy1.com, and that is from one of our partners, Pfizer's clinical trial. Both of them will tell you locations across the country where people can enroll, and either you'll get part of the vaccine, a little bit of vaccine, or a placebo, and you will be monitored and given a second dose and monitored to see if there's any adverse effects. We're hoping that there will be a vaccine by the end of the year or early next year. The National Academies of Science and Medicine has also asked us to be a part of the public comment testimony on the vaccine distribution plan. And I have to say that the first people that will get the vaccine will be the healthcare workers on the front lines, whether you're nurses or doctors or community health workers. And this will happen at the beginning of the year, assuming we have an effective and safe vaccine. The second group that would be given the vaccine would be those who are essential workers. And many of the Latinos that we will hear about today are all essential workers. So it's estimated that by June of next year, there would be quite a few people vaccinated. But of course, we all know that many people in our communities don't trust vaccines, don't trust the government, and it's up to us as trusted voices to let everyone know how important this would be for us to get back to what will be a different kind of normal. I don't think we're going to go back to the normal life that we had before COVID. Many people are going to be losing jobs. Many people are going to have to be given food and just basic sustainable effort on our part. We are thinking about how we will support our chapters and how we can all work to help our communities. And I want to thank today for the Texas chapters, the 3 Texas chapters of NHMA, to come together on this summit. I also just want to invite you to our scholarship award ceremony, where we will be honoring virtual leaders. Virtual leaders. We will virtually be honoring leaders, including the Surgeon General, Dr. Adams, and others. One of our awardees from Texas is Dr. Eduardo Sanchez, who's the medical officer for the American Heart Association. That will be a virtual event November 19th from 8 to 10 Eastern Time. The other event is our national conference. That will also be virtual from March 17th through the 20th. We moved it up a day. Wednesday, March the 17th will be the opening reception. The conference will actually be Thursday and Friday and Saturday. It had to be lengthened because we have to start later because of the West Coast. And you can find out more information on our websites, nhmamd.org and nhmafoundation.org. So again, thank you very much, and I look forward to the event today. And again, I think it's great to see Texas come together. Thank you. And thank you, Dr. Estrada, for your leadership in making this happen.
Bert, we turn it over to you to introduce Anna.
All right, so yeah, I'm having some difficulties. All right, sorry, I think we're trying to get rid of things. I apologize. I'm sitting here down in Sukondo Abariga trying to pull things together. So we'll be starting now introducing Hannah Hellenberg, who'll be giving our keynote speech. As I mentioned, she's a member of the Hope Border Institute. And I don't want to take up any of her time. Her words are worth listening to. They come from both her brain and her heart. Ms. Hollenberg.
Thank you. Good afternoon, everyone. My name is Hannah Hollenberg, and I'm very honored to be your keynote speaker today. Thank you so much to the Texas Doctors for Social Responsibility and to the National Hispanic Medical Association for inviting me to be a part of this great event. And thank you especially to Dr. Jaime Estrada and Dr. Bert Johansson for their mentorship and for presenting this opportunity. I'd like to introduce myself first as a proud fronteriza. I was born and raised in El Paso, Texas, and I also consider Ciudad Juarez, Chihuahua, our sister city, to be part of my home. I attended college in New York and worked for a statewide Senate campaign in Texas before becoming the policy specialist at Hope Border Institute. Hope is a Catholic human rights organization that works in both El Paso and in Ciudad Juarez, and was founded out of a recognition of the power of social justice teaching in the Catholic world, and the need to engage Catholic communities in a deep way in the struggle for dignity and human rights at the border. At our core, we're a binational cross-border organization, and our work encompasses research, leadership development, and human rights advocacy, particularly in the realms of immigration policy and a lived reality of migrants, as well as civic engagement for justice in the El Paso and Juarez communities. We're actually celebrating our 5-year anniversary this year, which is coming at a time when we're facing an array of challenges that not even the most gifted fiction writer could have dreamt up. And I'm actually from a family of fiction writers, so I know what I'm saying there. So today I wanted to talk a little bit about the work we're doing and what we've seen unfold at the border this year. It's a bleak picture, but it's not the whole picture. I also want to talk about the hope that I see in my community and the way that you all as medical professionals can help us to begin moving towards a border community where we can truly thrive and where we can be who we know that we are and become who we know that we can be. In the past several years, we've seen an increasingly coordinated and vicious attack against immigrants and border communities. And it's been no less than devastating to watch. No stone has been left unturned in the push to dehumanize immigrants and disrupt the daily lives of border communities, which are both literally and metaphorically on the edge. We're living through something that could be described as white nationalist political theater, and it is a strange, strange existence. There are some days, like the one in June 2019, when a private organization erected an illegal, privately funded border wall in our nearby town of Sunland Park, New Mexico, or the day that a militia came to town and began filming themselves, harassing migrants as they crossed into El Paso. And on those days, the absurdity of our situation is difficult to wrap your mind around. I know that you all, as dedicated physicians, have heard about and interacted with people from around Texas and around the country who've been affected by family separation, ICE detention and raids, reductions in social services, erasure from the community, and the resulting inability to access healthcare, food assistance, and other forms of support. And these are just some of the many ways in which immigrants, particularly those from Latin America, have been systematically and mercilessly targeted under this administration. So I want to share a bit of what we're experiencing here in El Paso and Juarez, two interdependent cities that share a language, a people, and an economy, but are also quite distinct from one another. While our way of life as a binational community has always been ignored in national narratives or looked at with suspicion and mistrust by the federal government, in the last few years, we've found ourselves held hostage to this white nationalist project of exclusion. We've been forced to play the role of a kind of laboratory for a politics of racism and dehumanization, where increasingly outrageous policies like the separation of families in 2018, are tested and rolled out in El Paso before being introduced across the rest of the border. And unfortunately, this is a role that's been forced on us time and time again in the deployment of these policies. As a community of immigrants that has long welcomed and cared for asylum seekers and migrants, it's been devastating to see ourselves used as a kind of testing ground for policies that criminalize some of the most vulnerable people in our hemisphere. When we cross the border and we see sections of the border wall going up, higher and uglier every week, It feels like our identity and the way we've chosen to be and the way we have been for ages is being stolen from us. As we become a staging ground for illegal policies that criminalize and kill, our needs, desires, and wishes as a community, as well as fundamentally our ability to manage the natural movement of human beings the way we have for centuries, have been ignored. So in March, as we were all growing accustomed to this new reality, as the pandemic was beginning to upend life as we knew it in the US, and as the steps were not taken that would have halted the spread of the virus and saved thousands of lives, the Trump administration saw the opportunity to finalize an anti-immigrant agenda that has been top of mind since the administration began. Their vehicle of choice was Title 42 of the US Code, a public health law, which is being used under the authority of the Centers for Disease Control and Prevention as we speak to expel anyone who arrives at the northern or southern borders without authorization. As of this date, there have been almost 150,000 expulsions of asylum seekers, migrants, and those seeking safety in the United States. The justification for the policy is that introducing migrants into congregate settings, the infamous crowded Border Patrol holding cells, where the flu spread like wildfire during a migration surge in 2019, leading to the deaths of several children, would heighten the risk of introducing COVID-19 into the US, even though exponential spread was already underway within the country. So this public health law is being used to halt all migration at the southern border, using the justification that introducing people into these congregate settings would inevitably lead to spread, as we know happens. But the irony is that the CDC a few years ago had actually proposed guidelines to Border Patrol about how to manage the spread of infectious disease, primarily the flu, within these facilities. So they have guidelines about how to actually manage the spread of illness and how to reduce it. And now the same CDC that proposed those guidelines is being used as the vehicle for these expulsions of anyone who arrives at the border without authorization. What does this look like in practice? Under the expulsion process, anyone arriving at the border in El Paso is briefly taken into custody and then taken to a port of entry and told to walk south into Ciudad Juarez or into other parts of Chihuahua. There are supposed to be exemptions to this rule for the vulnerable, including thousands of children traveling alone. But we're seeing that in practice, it doesn't matter who you are. It doesn't matter how vulnerable you are. It doesn't matter if you're a child, if you're an 8 months pregnant woman from Honduras. It doesn't matter. You will be expelled. As I mentioned, thousands of children have been taken into custody and housed in hotels with no access to attorneys or other forms of support. And then they're put on a plane back to countries that they fled, sometimes without parents or relatives being notified. What this boils down to is that the most vulnerable, like an 8 months pregnant woman from Honduras, who came to the US to seek asylum, are being turned back into an extremely hostile environment where they're immediately identifiable and immediately targeted as migrants. Life and death decisions that used to be made over the course of months or years under the supervision of asylum officers and judges are now being made in a matter of minutes by Border Patrol agents. The public health rationale, which was absurd on its face, was ousted as a farce, essentially, when a ProPublica investigation revealed that unaccompanied children from several countries are actually tested for COVID-19 while in custody, and they're only expelled if they test negative, even when there are families waiting in the US to hear from them and waiting to receive them. effectively, the asylum system is over after experiencing death by 1,000 cuts. It's important to highlight this because we, and I include myself in this, we've been so normalized to the rhetoric and the policies of the last few years, but it's difficult to understand just how much of a departure this is from our duties as a nation. The federal government is walking away from its treaty obligations, as well as its own domestic laws, in order to deter migrants by any means necessary. So in this context, the already accelerated human rights violations against immigrants that we saw even before the Trump administration have been heightened until essentially we have no system, and the law doesn't mean anything. Management of migration has been turned over to the Mexican and Central American governments, whose security forces, which are notorious for human rights abuses, have become partners in the Trump administration's efforts to deter Central Americans, Cubans, South Americans, Africans, and Haitians before they can even arrive in Ciudad Juarez. In fact, Mexico has been complicit in the implementation of the migrant protection protocols, a program begun a little over a year ago that has sent over 20,000 and likely more asylum seekers back to Juarez. People in this program face violence, extortion, and poverty on top of the trauma they were already carrying when they arrived. And with the onset of the pandemic, that insecurity has been ratcheted up, and the progress of their court cases, which were already very drawn out, has been halted. So people in this program are living in this painful limbo, unsure if they're ever going to be allowed to rejoin their family in the US and proceed with their asylum case, but also unwilling to go home. And you know, the terrible irony of this program is that it has made life so unbearable that even despite the dangers, many asylum seekers have chosen to return home, because we've made this area, this system so incredibly inhospitable that they feel that they have no choice. At the local level, El Paso and Ciudad Juarez have been extremely hard hit by the virus, and we're currently in the midst of a second wave of infection. We're a predominantly Latino community where roughly 1 in 4 and likely more adults are uninsured. About 22% of children experience food insecurity, and that was before the pandemic. We have multiple generations of families often living in the same households, which compounds the risk that the virus poses to the elderly and immunocompromised. High levels of economic insecurity and immigrants' fear of accessing support services have pushed people back into the workforce before it's fully safe to do so, heightening the spread of COVID. Dr. Fauci himself told our congressional representative, Congresswoman Veronica Escobar, that communities like ours are as vulnerable to COVID as nursing homes. In local ICE detention facilities, so facilities that are here in El Paso, we've seen several outbreaks, including one that's currently underway, where we have 46 active cases in 2 facilities in the El Paso region, which also includes southern New Mexico. And these outbreaks can be tied directly to ICE's failure to take even the most basic actions to protect detained people. ICE simply had no plan to deal with COVID. And because the fates of people in detention rest not on their humanity and their unique circumstances, but on ICE's political priorities, people continue to be housed in crowded barracks, in detention. At the beginning, there were really no hygiene supplies or masks available. Detained people were continually transferred in and out of facilities as the pandemic was getting underway. Sick people were housed within the general population, not isolated. And this is coming on top of a lack of medical care, essentially a failure to provide any medical care that was already existing within these facilities. And a lack of transparency from ICE means that it's incredibly difficult for local advocates like myself to gauge what the situation is inside of these facilities. So we have the case numbers, but aside from that, we don't know much about what's happening inside. In El Paso and Juarez, we have a very fluid population because we are a community of border crossing, where our economy and our relationships depend on being able to cross the border regularly. And that creates an interesting problem, which is that contract tracers are working across 2 languages, 2 countries, and 2 governments with differing public health regulations in order to effectively track potential spread of the virus. The ratio of known cases to deaths in El Paso is about 52 cases to every death, and that's known cases. Juarez has seen over 900 known COVID deaths compared to El Paso's known 550 deaths. And the ratio in Juarez is 9 cases to every death. So in other words, we have far more deaths in Juarez, but far fewer cases, which tells us that a vast percentage of cases in our sister city are going untested, unidentified, and untraced. Maquiladoras, which are these large border factories that employ thousands of people, they're the predominant form of employment in Juarez, and they produce everything from car parts to computers. In Juarez, those have seen major outbreaks, but they reopened in line with the US reopening of the economy far before it was safe to do so. So the decision about when to reopen those factories was based not on the public health guidance or the public health reality, which we don't fully know, but based on the US priority of reopening the economy. So I know that this is a pretty bleak picture, but the reason I'm here is also to share why I believe so strongly in El Paso and Juarez and in the future of our border region. It's the reason I decided to move back here, and the reason I see myself staying here, working here, eventually raising my family here. There's truly no place that I would rather observe and experience the world from than this kind and generous community, even when we are living through an absurdist play. What I'd like to propose is that I see a radical futurism in our border communities. We're a community of the future, but we're saddled with the burdens and the prejudices and the constraints of the past. The way that people here move fluidly across borders, cultures, and languages, and the way that our identities are blended and layered means that El Paso is actually at the forefront of a generational and demographic change that we're seeing throughout the US. The country is changing very quickly, and the white nationalist project that has arisen as a reaction to this change is very real, it's very devastating, but it's a final fight and it's being waged in desperation. I believe that El Paso has been targeted as a community precisely because of this fluid identity that we are proud of, and because who we are as a community is messy, and it doesn't fit into a mainstream understanding of what it means to be American and what it means to live on the edge of 2 worlds. As one example of our radical futurism as a community, the University of Texas at El Paso, or UTEP, has quietly but surely become a leading institution in the education of thousands of first-generation Latino scholars. We have hundreds, thousands of students who brave the long commuting times at our ports of entry in order to cross from Juarez and get their education here. And as a result, we have one of the largest bilingual and binational workforces in the country and in the world. And we have an economic might that has gone unrecognized because it's overshadowed by our portrayal as a dangerous community. For me, there's a dual heartbreak to this moment. Because at the border, we are recognizing who we are, we're asserting our strengths, we're building up institutions like UTEP, and we're realizing how much we have to offer at the same moment that our human rights and our well-being and our autonomy over our own community, our ability to self-determine, which is a foundational element of what it means to live in a democracy, self-determination, all of that is being steadily eroded. And it's devastating to watch the inhumanity with which migrants are treated, and to know that we could do so much better to offer a safe, compassionate, and dignified place of transit without resorting to the cruelty of detention and expulsion. And it hurts to know that hundreds of thousands of people throughout the US identify El Paso as the place where their suffering in this country began. So it's heartbreaking to know that, that this erosion of human rights and this dehumanization is happening, and also to know that we could do so much better. As a community, El Pasoans and Juarenses have consistently and passionately stood against the dehumanization of immigrants, and by extension, the dehumanization of us as a people. Thousands marched against family separation and the detention of children in a tent camp in Tornillo, Texas. Hundreds of El Pasoans volunteered at the height of the 2019 migration surge to provide food and compassion and support to arriving migrant families. As the bulk of the migratory flow has been shifted to Juarez as a result of policies like the migrant protection protocols, civil society in Juarez has stepped up to provide desperately needed shelter and aid. And actually, as HOPE, we've partnered with Bishop Sites to raise money to actually provide support for infrastructure projects and medical care in Juarez to migrants living in shelters, living outside of shelters. That's one thing I'm very proud of, is that work that we've done to support migrants living in Juarez as this shift has occurred. As a community, we're a loving and generous place, and we're waging a quiet but steady rebellion against dehumanization. Every border crossing that a person makes, whether it's pursuing love, an education, a job, or even just a good taco, is a quiet rebellion. Every meal that's offered to a migrant family, every person who is lining up right now to cast their early vote is a quiet rebellion. Speaking in 2 languages is a quiet rebellion. If we could shape our own future as a community, we could achieve some incredible things by taking full advantage of what we know to be our greatest strength, which is the relationship between El Paso and Juarez and the dynamism that brings. But to do this, we need the autonomy and resources and self-determination to really take the reins of our future and to take the reins of who we know we are and what we know we can do. And this means having a functioning and a robust healthcare system that offers a meaningful option to the poor and the undocumented. That means having a response to this pandemic that takes our unique strengths and vulnerability as a community into account and provides real guidance and support to those of us who are looking for guidance and support in how to move through this. We need sustainable economic development that provides high-paying jobs for those graduating from institutions like UTEP so that they don't feel that they have to move out of the community in order to pursue their career. And also fundamentally, we need to be able to manage migration and border crossing in a way that works for us. We need to modernize our ports of entry. decrease wait times, work with community organizations on both sides of the border to provide compassion and support to arriving asylum seekers and migrants. And we need to have our needs as a community consulted in the implementation of federal immigration policy. So many of you here today are putting your lives and your well-being on the line as a result of the failure to mount an adequate response to this pandemic. Even if you're not working directly with COVID patients, you're trying to keep yourself, your family, and your patients safe and healthy and get them the information and the care they need, especially if they're vulnerable and we're already struggling to access healthcare before this. And I want to thank you so much for this heroic work. It's not fair, but we're all depending on you, and we're all looking to you to be those beacons of hope and correct information and support. And it's not fair to put you in that position, but we're grateful. And I also want to say that my heart goes out to those of you who are in the Rio Grande Valley, like Dr. Fernandez. It's been heartbreaking to see our fellow border community going through such a devastating outbreak and being totally overwhelmed. So to those of you who are in that area and throughout Texas, know that El Paso and Juarez is with you in spirit, virtually, if not in person. So having said all of this, having led you on this emotional journey from bleakness to hopefully hope, I want to ask that you all join us in this work of building our thriving border community. We may be on the edge of the US, we may be on the edge of many Americans' minds. We are here on the edge, but what happens to us is really important. What happens here at the border is so important. And I feel, that what is done to us here will eventually pour out into other parts of the country. As I mentioned earlier, this project of white nationalism that we're seeing unfold will use any tool at its disposal, including public health and medicine. We're seeing this along the entire border and in countless communities across the US. Public health and the CDC are being used to further an anti-immigrant agenda and to renege on our treaty obligations, domestic laws, running roughshod over human rights and dignity. It's not the first time, and it will not be the last, that the medical sciences are used to exclude and to dehumanize groups of people. Recent news accounts of women given hysterectomies without their full knowledge and consent at ICE detention facilities in Georgia are shocking. But we've seen time and time again that healthcare or the denial of it can be used as a tool of harm against immigrants and against people of color, unless we take a firm stand against it. As Latino doctors, nurses, medical technicians, and professionals, we need your voices in this fight. You've been placed in a terrible position during this pandemic, and your perspective as lifesavers and as survivors is very much needed. We need you to speak loudly and to say over and over again to whoever will listen that what is happening at the border is wrong and that we can do better.
Sorry to interrupt you. You have 2 minutes.
We need young Latinos to be empowered to become physicians and to stay in their communities and provide healthcare to the people that they know. We need your talent as we seek to rebuild our society and to construct a community of love that cares for the vulnerable. We need your insight as we continue to wade into uncharted medical territory while COVID-19 is ravaging Latino communities. We need you to speak up for equity at the border, to make sure that the eventual COVID vaccine that Dr. Rios was mentioning is equally distributed and that border communities on both sides are able to access it. We need you to move beyond doing no harm and join us as we combat the dehumanization of migrants and border communities. So thank you so much. Thank you for your work. Thank you for joining us in this work. Thank you.
Thank you, Hannah, for a very rich and moving presentation. I want to take this opportunity now to turn it over to Mr. Olivares.
Hello. Hello, can you all hear me?
Yes, we can.
Great. Well, Dr. Fernandez, it's great to see you.
Likewise.
Well, my name is Eddie Olivares. I'm assuming I can start now. I'm not really good on the Zoom thing.
You have 10 minutes.
Oh, great. My name is Eddie Olivares. I'm the Chief Administrative Officer of Hidalgo County Health and Human Services. And it's a tremendous honor to be presenting here today with such a distinguished panel. And of course, with my dear friend, Dr. Fernandez, who I've had the pleasure of knowing for several years. I am the administrator for Hidalgo County Health and Human Services. Geographically, Hidalgo County is in deep South Texas along the US-Mexico border. The city most commonly people identify with is McAllen, Texas. We're about 35, 40 miles west of Brownsville. Our sister city would be Reynosa, Tamaulipas, along the border. So my primary focus today is talk about the public health impact from COVID and from other illnesses here in South Texas along the Rio Grande Valley and Hidalgo County, and how the role of young people have influenced that in either form or fashion. Let me just give you a quick overview about our county. Our county is the 7th most populated county in the state of Texas. We have right about 1.2 million people in our county. That is not counting the approximately 300,000 or so who are off the grid, who are immigrants here, in what I call the bubble. The bubble is between the border, the Rio Grande River, and then the checkpoint with Border Patrol or Customs Border Protection checkpoint 65 miles away to the north. If you live in that area in between that, in that bubble, pretty much things are copacetic. But trying to get beyond that bubble, beyond that 60 miles, 65 miles, becomes very, very difficult, especially for immigrants here in South Texas. So we have a large population that's an immigrant population. We have a very fluid economy between Mexico and Hidalgo County. But unfortunately, like many other border communities from California to Brownsville, we have extreme or unequal representation when it comes to healthcare. Our population here in Hidalgo County, between 40 to 45% is uninsured or underinsured. By far, the majority of our population is covered through Medicaid or takes part in our FQACs or public health programs here locally. Most recently, this pandemic has affected our community tragically. Unfortunately, Hidalgo County ranks number 2 in the state of Texas for fatalities to COVID. Now, when you sit down and think about it proportionally, our numbers are the highest in the state when it comes to fatalities per 100,000. And that is a concern. But how did we get here? Well, one, we got to talk about preventive medicine and the lack of it for people who are uninsured or underinsured. Most recently, UTRGV Medical School has joined us here in South Texas in the last 4 years, 5 years. And UTRGV Medical School has made the biggest difference in our community. I see preventative health care increasing and improving to great levels over the next generation. But for right now, it is early on in the development of the medical school. And there is a lot of effort, 28 different clinics by UTRGV providing services here in the Rio Grande Valley at no cost or low cost services, and establishing the medical homes and the preventive medicine much needed. But going back to COVID, as of this morning, and I got to look at my cheat notes here, excuse me. As of this morning, the most current data that I have, in Hidalgo County, we've had 33,788 cases of confirmed COVID. Unfortunately, we've had 1,884 deaths in our county as of this morning. And let's break down that death. I want to share a screen with you all, and so you could see if I get permission to do this. I want to show the total number of deaths. We've had 1,884 deaths, but what's important, look at this scale here, 50, 60, 70 plus year olds. We're looking at 1,662 fatalities, or 88% of our fatalities are older than 50 years of age. And you're saying, Eddie, what does that have to do with discussing this when it comes to our youth or the young people in our community? Well, when you look at the numbers for people less than 50, 40, 30s, 20s, and to the teens, you can see the dramatic difference in the age group, especially in 25 fatalities of people that are in their 20s or less. But the issue here in these people and these patients that have died from COVID in this age group, actually in the 30s and less, the number one factor for them is diabetes, and the most difficult factor is obesity. I'm talking about morbid obesity. So when it came to the young people dying in our community, many of them had severe diabetic issues and obesity issues, where in a non-COVID period or a non-COVID infection period, they might have had another 10, 11 years of life, 12 years of life, considering that COVID would not be in part of their life. They would probably have an opportunity to get healthier, be able to lose weight, get better, but COVID shortened that for them. So that's been a very tragic area in dealing with COVID in our community. But the more tragic piece of it has to do with the fact that in the 50 plus years age group, that we, as many border communities have, is multi-generational households, where you have, it's very common to have the parents, grandparents, children, nieces and nephews all live in the same household. And here in the Rio Grande Valley, part of the concerns we've had with the 1,084 deaths have been that many times the younger people have brought in the illness to their home and exposed the elderly grandparents or parents. In fact, it is so tragic. It is very common to have, out of these families here that have lost many loved ones, I've had coworkers pass away. I've had friends of mine that have lost both parents and a grandparent, 3 in one family. It is all linked back to an infection that came in from a family member, usually, not always, but usually a younger family member who is due to their workplace or due to their travel or due to their social life, have brought that virus and that infection into the household, and it's impacted the elderly. So in this point of view, a lot of people say, well, it's impacting the elderly, but the very young play a very large role in this. And I'm not saying that it's their fault. What I'm saying is the more we educate our younger community and the more we educate parents on how the whole family structure can impact the elderly members of the family, it is very important to really focus on our education and awareness and preventative efforts with the very young and our family members who may be able to expose some of the elderly, less mobile family members. The other thing to consider is that who better to understand all the technology that's being required now in schools? Our young people really, I rely on my granddaughter sometimes to help me figure out my computer or my cell phone. She's very good at figuring out passwords. I got to come up with 12-digit passwords now because she's very good at figuring them out. So the reality is that we rely on the younger generations to help us with many of the other issues. So what's important here for us is that we need to look at how can we blend these 2 generations or 3 generations many times to really provide a good, sound, healthy structure to prevent the ongoing COVID infection. The reality is COVID is not going away. It's going to be here just like the common flu is. It's going to be here for a while. Now we're dealing with vaccination programs. We're dealing with school issues. Our school numbers are increasing. We were just recently, in the last 2 weeks, we worked with the Texas Education Association and our Regional Educational Center in monitoring infections in schools. We are not doing full-time school yet. We're still on virtual school, but in some cases, there is a limited amount of students attending school. We're seeing an increase in confirmed cases with the staff, and we're seeing increases in confirmed cases with some of the limited students going to school.
You have 1 minute left on my apologies.
Thank you, Dr. Fernandez. So one of the things that we all need to understand is that we have an opportunity as a community to come together in a multi-generational component and be able to come up with a way to prevent COVID, to prevent other infectious illnesses. And it really falls upon us as parents, grandparents, great-grandparents, educators, and professionals to do that. I'm very happy and very proud to be part of this today. I hope this information was informative. May the Lord's blessings be with each of you. Thank you.
Thank you, Mr. Alvarez. I just want to let Adam know that I cannot start my video because the host has stopped it. Okay. So now I have to be the bad person, the timer person, but I'll turn it over to Ms. Gomez from one end of the valley to the other in Brownsville. Ms. Gomez, you have the floor.
Okay, I think, can you hear me?
Yes, please.
Okay, thank you for asking me to do this. I'm not really sure what I'm going to have in the end, but let me just give you a little bit of background. I have been in the community healthcare business for a little over 45 years. I apologize for using the mask, but I have a medical director that has insisted that we all wear masks. So I am doing that. We lost an employee some months ago, getting ready to come back to work with COVID, had seemed to be doing okay, tested negative, was ready to be discharged, was talking to the doctor, and a few minutes later went into cardiac arrest and died. I think that was a shock for the entire staff, and we doubled up and decided all of us would take really good care. While the employee did not appear to have gotten it here, he got it from his wife, ended up, the wife had it, the father had it, the grandfather had it, and a brother had it. Everyone died except for the wife and their 4 kids. It is a problem that we live with every day since March. At first, I thought we were all going to go crazy, but we haven't gone crazy yet. But just for those of you that have never been to this end of the state, we are on the border and by the sea. Cameron County has a population of 423,163 as of 2019. And this summer, we seem to be getting a little bit of relief. The fatality rate had gone down from 4.6% to 2.83%, but we're beginning to see an uptick again. So, what can I tell you? In the beginning, when we first got hit with this, thank God we have the medical director that we have. He's on top of it all. He called a meeting of the medical staff and the support medical staff and together devised a plan before the end of the day. They were out of here by 8 o'clock that night and ready to go. The first couple of weeks were a little bit crazy because we kept changing some of the protocols, but essentially we developed a COVID unit, and it appears to be working. It works extremely well. I couldn't help but hear or listen to what the other speakers were alluding to with the border issues. Fortunately or unfortunately, we have borders on both sides. The Port of Brownsville does, on occasion, send us patients when they have people coming in on ships that are sick and need attention. And then we have those that are feeding into our unit because they're desperate. They're here. Used to be they could go to Matamoros for care, which is on the other side of the border, but the borders were closed. And so now that's not the case. People are not venturing into Matamoros for fear of not being able to get back. There are also those that have been here for years and years, but rely on curanderos, and now with this COVID issue, are realizing that it's bigger than what they can handle. So sometimes they're showing up, and they're showing up very late in the game. Getting them into the hospitals is always a big, big chore. It's not just a matter of they don't have beds, but there is no one that is going to back up the cost of delivering the care. Despite the fact that we are told that no one is turned away, in fact, they are, for whatever reasons, including the fact that they might not have beds, patients are being sent home to wait it out until they absolutely cannot breathe anymore. It is unnerving, to say the least, not just for myself, but for our medical staff to have to deal with those issues. While some of those issues are not new, it used to be that we could just say, wait until 5 o'clock, wait till administration goes home, and then get your patients in. It used to be that we even started IVs so that they would not be turned away. None of that is working anymore. So we continue the fight. We continue to look for ways to get in there. We have plenty of PPE. Fortunately for us, because we're an FQHC and because the government had asked us to be a partner with them during the Ebola crisis, we had plenty of PPE. And thank God we didn't have to use much of it. So we're not short of that at this point, thank God. We have trained staff, and we continue to train every day. We're up to date with whatever the CDC is letting us know that we have to do, and we will continue to do that. it is sad that in this day and age that the biggest hassle we have is still obtaining care for our patients. And that includes sometimes people that have insurance. Our population that we are serving, some 20,000 patients that are registered, are adapting. They are now learning to use their phones, etc., for televisits. How long this will last, I don't know. Vaccines, if you ask me if I would take a vaccine right at this moment, I'm going to say no. I think these are crazy times, but they've been crazy for a while, and I think we're getting used to it, and that's a sad state of affairs. I think we need to get the big wigs to start thinking in terms of what happens in the future. I don't think we're getting there. I don't think we're there yet. What we're doing here within our own confines is trying to plan the best we can to make the dollars stretch as far as we can without compromising the care that we give. Dr. Fernandez, it's yours.
Thank you, Paula. I can't help but think after your presentation when you say we've been through many crazy days, that today happens to be National Latino AIDS Awareness. So we're struggling on multiple fronts always. But we'll continue now with Dr. Mercado, from crossing now again the county line one more time, from Cameron now to Hidalgo County. Dr. Mercado.
Yes. Hello, everyone. Thank you for having me here today. I do have some slides to share. And I would like to thank Dr. Fernandez and the National Latino Medical Association today for inviting me. And I know Dr. Fernandez from the University of Texas, Rio Grande Valley. As he noted before, I am a clinical psychologist, and I have a multicultural clinical lab in the doctoral program in clinical psychology. In addition, I'm also in the psychiatry program, in the residency program, where I help out with the training of the residents in psychotherapy, in addition to helping out with the medical students in their psychiatry clerkship. I'm also part of the Texas Psychological Association. I'm president-elect of TPA, the Texas Psychological Association, and also part of the Committee on Rural Health of the American Psychological Association. And I am part of an editorial board of the Journal of Clinical Child and Adolescent Psychology. Just some disclosures I wanted to share with you today. All right, so we did hear Hannah's amazing speech on on Paso and all the critical issues that our country is facing. And our other two speakers right now also identified the uniqueness of the Rio Grande Valley. And I wanted to share just some slides on the uniqueness of our region here in Texas. We do have 1.5 plus million individuals residing here in our backyard. And what's also unique about our community is the different colonias that we have. We have over 1,200 colonias in South Texas, and 900 of them are in Hidalgo County. Across the border, there's hundreds more of colonias where about 500,000 individuals live, and 100,000 of them are children. This is the reality of our backyard here in the Rio Grande. We do have these living conditions that hundreds of families, are exposed to. And this is just one picture of one. I do visit families in these colonias, providing, psychological services and the different programs that I'm involved with, in addition to the different research projects that my students and I are undertaking. What we know and what was also highlighted is the devastating rate of obesity and diabetes in the Rio Grande. And as Mr. Olivares shared the numbers, the very significant numbers of the COVID deaths and the cases here in our community. These chronic medical conditions are we're plagued with these conditions in this community. Hence, one of the reasons why we're number 2 of COVID deaths in the state of Texas, given that these are contributing medical conditions to falling ill to COVID-19. As we already know the numbers, Mr. Olivares just mentioned the current numbers here in Texas, and these numbers are devastating. They are devastating, and as a result, of these continued increases in cases and deaths, both medical staff and the public have been experiencing psychological problems. Others have noted that really the reality is we're not only going through the COVID-19 pandemic, we're also going through a mental health pandemic. Being part of the psychiatry program, we've been consulted by many different hospital administrators here in the Rio Grande. They've been knocking at our doors, wanting to see how psychiatry and how psychology can play a role in the significant mental health symptoms the frontline workers are experiencing. Many nurses and doctors are experiencing, symptoms of post-traumatic stress disorder, anxiety, depression, and they wanted to know how can the UTRGV School of Medicine, how can we help? So we've been working on a couple initiatives with the different hospitals, given the rise of COVID-19 cases and deaths here in our backyard. A growing body of research does highlight a significant increase in mental illness. One study identified 21% increase in mental illness, including trauma-related disorders. Not only are we looking at mental health symptoms and trauma symptoms, but also we're looking at maladaptive coping. A lot of people are resorting to maladaptive coping strategies, substance use, overeating, really unhealthy coping strategies. And that's why, mental health is so important right now. The general population is at risk for poor mental health due to the fear of the virus, the shelter-in-place orders, the socioeconomic burden of reduced employment, and Latinos are really getting COVID-19 has unfolded the disproportionate, rate of COVID-19 has unfolded the realities of health inequity in our country, given the numbers that we just shared today. There's a local study I wanted to share with you guys today by Dr. Bianca Villalobos and Juventino Hernandez, my colleagues at the University of Texas, Rio Grande in the doctoral program. They did a mental health study here locally in the Rio Grande. They were looking at mental health symptoms related to COVID-19 pandemic. This manuscript is in preparation, so I'm sharing with you really important data that is soon to be published, and it's right off the press. Preliminary studies that they shared with us. 73% of their population they sampled here in South Texas reported anxiety symptoms. And almost 50% of them were in the moderate to severe symptomology range, identifying a clinical disorder related to anxiety. They also included a PTSD measure, and roughly almost 30% met the provisional cutoff score of post-traumatic stress disorder. These numbers are alarming. We are living in a mental health pandemic as well. And these local numbers does support that. Not only anxiety and PTSD, but depression. 74% reported depressive symptomologies, and roughly 27% highlighted moderate to severe depressive symptoms, and only 9% of them are receiving mental health services. We know there's a lot of barriers, there's a lot of obstacles for mental health treatment, especially amid a pandemic, to culturally diverse populations. Interestingly, 65% of the people in the study did have an essential worker, living at home, and 60% of them had someone vulnerable to COVID-19. As I mentioned before, COVID-19 has affected the Latino community and other culturally diverse populations in the country in disproportionate rates. As we know, the undocumented population don't have the luxury of sheltering at home. They weren't eligible for the CARES Act, so they didn't have that financial support. They need to work. They're being exposed to COVID-19, and they're bringing it home to their loved ones. Another group that I wanted to share today in my talk is the immigrant population, the refugee population. This population, Hannah shared it in her talk earlier, but I wanted to share with you today the type of work that I'm doing here on the US-Mexico border, both clinically and in the research setting. As a psychologist, I do pro bono work with many organizations in the community, doing evaluations, in addition to many different projects. We published multiple articles that have highlighted the alarming trauma rates among the refugees and the immigrants that are seeking refuge here in our border. The studies that we published highlighted the trauma symptoms in these families and children, most of them coming from the Northern Triangle, had elevated trauma symptoms far exceeding the PTSD clinical cutoff score that we use here in our country. And the rate of trauma that we saw were very similar to trauma rates seen in children that are countries that are at war. And these are children in our backyard. Phase 2 of a study has led us to the tent encampments. Earlier today, we heard about the migrant protection protocol policy that the current administration has. Hannah mentioned 20,000 families are living in Ciudad Juarez in Chihuahua. Well, over 40,000 families have been affected. They're going to other cities too, Tijuana, Nogales, and Matamoros. My student, Francis Morales, and Sister Norma Pimentel, the director of the Catholic Charities of South Texas here in the Rio Grande Valley, we partnering up with the second phase of our project, research project, looking at trauma, symptoms, and health in these families. Unfortunately, because of the Remain in Mexico policy, there are tent encampments along the Rio Grande River. The closest one here is Matamoros, where thousands of 2,500 families are currently living in tents there. Because of COVID, some have left home.
Dr. Mercado, you have 1 minute left.
Some of the things, thank you, Dr. Fernandez, some of the things that these families are exposed to during the migrant protection protocols and the Remain in Mexico policy are very, many different acts of violence. They continue to be victimized. Not only are they have the pre-migratory trauma, in addition to the migratory trauma that they endure, and then currently in the tent encampments where they're living, some have been kidnapped, tortured, raped. These are some pictures that I wanted to share with you today. This was pre-COVID, and unfortunately, there are no government entities providing aid. There's no U.S. government entity providing aid in our southern border. Only nonprofit international aid was provided, but this is another population that has not been given a lot of attention. On July 31st of this year, I provided some of my research with the Hispanic Congressional Caucus, where we talked about the realities of the U.S.-Mexico border. And this is another group that has been significantly affected by COVID-19 because their asylum cases haven't been heard. And hundreds and thousands of them continue to wait their hearing. So thank you so much for having me here today. And I'm going to go ahead and stop sharing my slides right now.
Thank you, Dr. Mercado. I believe now that it's time for going now out of the Rio Grande Valley and over to El Paso and have Bishop Seitz take the floor.
Good afternoon, everyone. Can you hear me? Hopefully so.
Yes, I believe so.
Good. It's a pleasure to be with you all. I appreciate the invitation. It's so encouraging for me to know how committed all of you are in the Hispanic Medical Association to really knowing about these realities along the border and serving this population. I come to you with a certain expertise on the present circumstances with COVID, having just been released from quarantine yesterday. So I had to, thank God, it just had very mild symptoms, low-grade fever for a few days, and then really just insignificant kind of symptoms. But I went into quarantine after I started to believe I actually had it. That took the second test. Fortunately, I've been released and feeling great. I wish I could say that our community is doing well here in terms of COVID. Right now, we're experiencing, I think, what South Texas went through a month or so ago, with a tremendous spike in cases. We're at our highest rates recorded to this point. And today's report, there were 737 positive cases. We have 6,887 active cases. This is a community of about 850,000 people. Our positivity rate is about 12.4, and the hospital utilization rate is at 28%. So it really has us concerned, and the mayor has come out with new restrictions today, as one might well expect. I think the Catholic Church is uniquely qualified in a certain way to be involved in these matters, where we don't understand Christianity as a faith that's supposed to be kept inside walls. It's not simply a me and God, but as our church teaches so clearly, and as Pope Francis has communicated so well, we are a church that has been called to a kind of discipleship, and our faith needs to lead us to service, to solidarity, and so on. And in a certain way, it particularly well equips us to serve on a border, because we're a community that realizes that while borders may have their usefulness in political terms, they don't mean much for a disciple of Jesus Christ. We all are called to belong to the same family, and our basic tenets, we hold to the equal dignity of every human person from the moment that they are created in their mother's womb. And so we're very concerned about what is happening on the border, both in terms of the immigration reality, in terms of the presence of inequities and poverty, and in terms of the impact of the COVID crisis. As other speakers have already pointed out about El Paso, I think perhaps in some ways more deeply than other border areas, although it's always true to some extent, we are tremendously interrelated and interdependent. If you come to El Paso and look at it from above, you won't be able to see where El Paso ended and Ciudad Juarez began. We're probably, in population terms, the largest binational community, at least in the Western Hemisphere, with our 860th or so thousand in El Paso, another 100 and plus thousand in Las Cruces, New Mexico, and then 1.5 million in Ciudad Juarez. So been asked to share with you some of the impact of the COVID crisis and the government's response to that on our reality here on the border. The border, for all intents and purposes, except for commerce, has been shut down. The only crossings being permitted now are those that are considered essential, and that means primarily economic reasons. But for a community that has family on both sides of the border, you can imagine the consequences. There are families with parents they live in the children live in El Paso, the parents live in Juarez, and the kids can't easily go across the border to care for their parents. And it's even more difficult if you're talking about movement from Juarez to El Paso. From Mexican citizens can't hardly cross. That would be true. Spouses are sometimes separated. Children are often separated from one parent or another. There are businesses that are totally dependent on the cross-border traffic. That is true of El Paso businesses as well as businesses in Ciudad Juarez. Many El Pasoans go to Ciudad Juarez for medical and dental care. Students have had a difficult time crossing back and forth, and I haven't heard real recently, but at the beginning of the school year, they were having a very difficult time crossing. There's been a slowdown at the border crossings from Mexico to the United States in particular, in order to discourage people from coming for less than essential reasons. The CBP has closed down gates, and the wait can be easily 3 hours, 4 hours or more for those who don't have rapid passes. In terms of people here on the El Paso side, immigrants have lost jobs, of course, especially in the service industry. And most of those jobs, they don't have anything to fall back on. Many have jobs that have put them at risk, those so-called essential workers, including, for instance, farm workers, people in the service industry, people that do the cleaning in offices and hospitals and other places. These same people were would have been less likely to have insurance, less likely to receive the stimulus, and so on. Of course, when it comes to healthcare, you all are more familiar than I with the inequalities that exist in that regard. The President of the United States gets sick, and immediately he receives a new experimental drug that's been given to 10 people, and recovers. But people here along the border, they get sick and they're afraid to go to the hospital. They don't have insurance. As was mentioned earlier, they wait until already their case can be very advanced. They also have so many comorbidities. In fact, the Hispanic population is ultimately being hospitalized for COVID at a rate that is 4.6 times higher than the general population or the Anglo population.
Bishop Seitz, you have 1 more minute, sorry.
Okay, thank you. Time flies when you're having fun. Obviously, and I think Dr. Mercado pointed out, there are great anxieties and fears in our community. We're very concerned for those who are trapped in Ciudad Juarez, immigrants, and as was mentioned by Hannah, we're very proud of our Border Refugee Assistance Fund that we created to be able to assist them. But in the minds of most Americans, those people don't even exist anymore, since they're on the other side of that imaginary line. The church is ready to collaborate, ready to serve, ready to help in whatever way we can, with whatever gifts that God has given us, with you and with anyone of goodwill. Thank you very much.
Thank you, Bishop Seitz. I almost called you Bishop Juarez. I'm sure they feel that way about you. We're going to open it up to questions now, and Dr. Johansson and I will be distributing questions to the panel. So Bert, if you're on, I know that he was, there he is. I know that he was on call, so I wasn't sure if he was with us still or not. There is a question touching on basically everybody's discussions about the communities that we're in and whether or not you are receiving, quote unquote, adequate support from hospitals to ensure that people are receiving adequate care. I know in our area, that's a big issue because all the hospitals really are for profit. So I don't know if in the El Paso area there's a county hospital. And certainly if Dr. Estrada could speak to San Antonio as well, I think that it would be helpful for people to know that are struggling to make sure they have adequate resources in their communities.
Frank, did you ask me a question, Frank?
Yes, could you not hear me?
I missed that. I was busy with technology.
Okay. Well, the question is, I'll repeat it. It's that there's a question about receiving support from hospitals and to ensure that communities are receiving the adequate care that is needed. And so every community is different with county hospitals. Some have just for-profit, some no hospitals at all. But if you have, Bert, if you could mute yourself, good. Okay.
There you
are. If people could speak to that, respective communities.
Hang on just 1 second, please.
Yeah, thank you for the question. Yes, can you hear me?
Yes, we can.
Okay. So yeah, just as in many other large cities in the country, San Antonio has been quite busy taking care of COVID patients. And fortunately, we've had a very progressive leadership in the form of our mayor and our county judge, who have been working together, and since the beginning, and despite protests from Austin and from the federal government, they've instituted the basic rules to control this disease, like social distancing, wearing masks, and all those things that have that prevent the illness for the most part. And so yes, we had our peak About 2 months ago, things have stabilized. People are still dying, but not to the extent that they were when we first got it. Our hospitals that at some point were extremely busy are not to that point, thanks God. There's still COVID patients in the ICUs. And as I said, there's still some people dying because of that. But for the most part, the response of our leadership on Major Ron Nirenberg and County Judge Wolf has been excellent, working with Metro Health and the other agencies from the government that look into this, into how to best control the pandemic.
Thank you, Jaime. Bert, do you, from El Paso, you feel like you're getting the adequate resources in terms of being able to serve the community and what's needed there?
No, I don't think we are. And I apologize, but I had to run out. We're short, and there are some hospitals. You know, we have 2 for-profit hospitals here in El Paso, and they're bringing in some outside help to help replace. But there's been such an effort to reopen and, of course, do the very profitable elective surgeries, and this has put people at risk. You know, even our not-for-profit hospitals are being run by people who are former HCA, and they're being run for profit. So with that said, you know, the hospitals are, you know, we have 9 available ICU beds available today. But between, you know, my hospital work and what we're doing here in clinic, I'm seeing 80 to 90 patients a day with both pre-COVID and post-COVID. We're reusing our PPE, we're sterilizing our mask on our cars, you know, to get the UVC from the sunlight. You know, we're wearing our jackets and over and over. So in terms of doing, you know, high quality care, we're delivering care for our community, but we need some more support. And we're behind the curve a little bit in that we opened up a little too soon. We opened up.
Yeah.
Sorry. Yeah.
Oh no, I'm sorry.
Hi, Hannah.
Hello.
I
Go
love
ahead,
your
Hannah.
talk.
Thank you. Yeah, I would echo that. I think the push to reopen was really premature, and that's definitely hurt us. And as has the fact that, so at the local level, our city government chose not to make public the locations of clusters like schools and businesses and you know, nursing homes. And I think a lot of other cities in Texas have taken that step, but so we don't have any insight into where clusters are happening. And there's also been, you know, at our previous peak in July, there was very lax enforcement on businesses. So there were just very few citations issued, like an astonishingly small number of citations issued to businesses that are not complying. So essentially it's become kind of a free-for-all. And I mean, I think, you know, it's sort of this feeling that we're on our own. You know, you have to sort of be your own public health department. We hadn't had a public health, we only recently got a public health director appointed, which is disappointing. So we went into this pandemic without a public health director. There's a person who's appointed to manage the coronavirus response, but our public health department was missing a leader. And so so I think it's, you know, sort of a sense that we're on our own. You have to sort of make your own guidelines. You have to sort of, you know, craft or decide what risks you're comfortable with taking. And so it's just been really, really difficult in that respect. But of course, the doctors and the medical professionals are bearing the brunt of that and experiencing, you know, the result of that.
Paula, you made mention of issues of hospitalization from the Brownsville Community Health Center for patients. Do you want to add or expand to what's been said?
It could always be better. I think we don't have any nonprofit institutions here, except for 2 clinics. So getting people hospitalized is always a chore. And like I mentioned before, we do try to wait until 5 o'clock to get people admitted. Sometimes it works, sometimes it doesn't. Let's just say we exaggerate sometimes to get the patients in. But there's also on the hospital's end, of course, they're a for-profit institution and they don't want to lose any money, so they're figuring out ways around us. What we are seeing is that many of our patients are just staying home or going home, and that's essentially what the county is advocating. They're basically telling everybody just stay home, stay quarantined, and if you have trouble breathing, then try to go to a hospital. We can't control the money. We can't control administration. It used to be, we used to say to people, well, you can go to Matamoros and the hospitals there, we have a good relationship with them. But now we can't even do that. So we are where we are.
To tie in a little bit of what's been said both by Hannah and Bert in terms of opening early, I'm assuming, and then of course, Bishop, you mentioned the commerce-related issues. And, you know, we had an issue here in Starr County where the only public hospital there was turning away patients and was making decisions whether somebody could be admitted, whether somebody should be on a ventilator or not, and it drew national attention. And now there's talk in our end of the valley about opening up the border because commerce is taking a hit. And I'm sure that this issue of are we ready? Are we not ready? What kind of safeguards we need? But if we are developing safeguards for allowing greater exchange, I wonder what safeguards Bishop and Bert and Hannah have you had in place in El Paso for the ethical distribution of distributed care, if you will?
Well, I think the frustrating thing is that everything has been opened except for the border. So we really need our border community depends on that foot traffic that Bishop mentioned. We depend on, that trade that goes back and forth every day. We depend on, that's our lifeline. And so when that continues to be shuttered and when there's Customs and Border Protection implemented a plan to basically make crossing as difficult and as long as possible. So they've consciously shut down crossing lanes and, made decisions in an effort to stifle traffic. It's not really working, but so it's like everything is open except for the things that we really need to be open, which are, our schools and the border. And, we can,
president, new president-elect, we wait till next year and do something at that time, at least part of the appropriations bill. So we are ready to add monies to our healthcare providers. In fact, I just announced some monies here in my part of my district, Wilson County, just a couple of hours ago, and I work very closely and support the community clinics and of course the hospitals and making sure that we get money, especially to the border area. Let me mention, because y'all brought up one part about border crossings, because I actually have been involved in negotiating, which I hope will be something that will be announced either, if not Friday, but early next week. And that is, do we do something about border crossings? The language I've negotiated, and I'm hoping that they come up with it, unless if lightning strikes from the White House and somebody asks in the White House, why are we letting Mexicanos in 2 weeks before my November election? So if that lightning doesn't strike, the opening of the borders will be something similar to this, unless if they extend it a little bit longer. Right now, as you know, they're letting essential people come in, trade, medicine, anybody that works for that. And in fact, trade is almost back to where it was. My hometown of Laredo that handles most of the trade. You can take all the trade from El Paso down to Brownsville, number of trucks. We handle 51% of all the trucks across the Texas border. So I can talk about my area, the valley, the Laredo. We're back to almost normal to where we were before COVID-19. In fact, the World Trade Bridge and the Columbia Bridge were now handling 75,000 trucks a day coming south, another 7,500 coming north, and 7,500 going back. So trade is increasing. The problem is when the White House in Washington put a restriction on what they call non-essential. Non-essential is the tourists or the people that come in, whether you're in Paso, Eagle Pass, Laredo, Brownsville, McAllen. A lot of those stores depend on 50 to 75% of their business is from the Mexicanos. And in fact, before COVID-19 and before President Trump, Mexico was sending about a little bit over 18 million Mexicanos shoppers, and they would spend over $19 billion in the US, a lot of money, restaurants, stores, hotels, etc. That has slowed down because they closed the border restricted the border to what they call non-essential, which we call essential down at the border. The plan that we have, and again, we'll find out in the next few days, early next week at the latest, before October 21st, is something like this, unless if it changes, the lightning strike from the White House. And that is this, every city, every community, depending on the advice of their local health department or their health, the doctors will decide we're ready to open up the border at that point. If you take the city of El Paso, the city of Brownsville, Laredo, wherever it might be, if they decide that they're ready to handle the Mexicanos coming in, then they make that decision jointly with CDC, DHS, and the local health providers. If a community says, no, we're about to open up schools, so we need a little bit more time, then they can wait and not open up the border in that particular area. So everything I put in there, the language I have there is local control. So either you say yes or you say no, depending on what your local community COVID rates are, hospitalization rates, all that, depending what's happening in Nuevo Laredo, Reynosa, Ciudad Juárez, Matamoros, or whatever the city might be, Piedras Negras, whatever the city might be across the border. You all decide that. That is what I'm hoping will be the plan. And so next week, we will hear something where the secretary will say, we'll open it up as predetermined criteria, like the ones I gave you. or they could extend it for another 30 days. I'm hoping, because the months of October, November, and December are very, very important, that we will, for shoppers and for the stores downtown for employment, that we can find a balance between the health of the individual and the health of the economy. The Mexican shoppers will basically have 2 screenings. One is when they come in, CBP will do their own protocol. They do the observation, and they go through their own screening process. Then once they step out, depending on the city, they can have a different screening. I'll tell you what Laredo is looking at, and again, this is all subject to change. We have 5 bridges in Laredo. 2 of them are non-commercial. Bridge number 1 can be used for pedestrians. So it's set up, the configuration is set up where somebody comes in, and then they will do after they get out of customs, they'll do the temperature checks. They'll give them the orders of the city in Spanish, make sure they're wearing the mask. And then the city is looking at possibly doing random testing there. Bridge number 2 is set up for vehicles and for buses, so that probably will be used for that purpose. So, but every city will decide what they want to do. If they want to do something after the Mexicanos come in, and there will be basically 2 screenings, if I can say it that way. The other thing I asked them to do was, I asked Homeland, is to open up more lanes for the non-essentials and add personnel back, because as you know, they couldn't stop legal residents or U.S. citizens from going into Mexico and coming back, and they made their lives very difficult by making them wait for 2, 3, 4 hours. And I thought they put them in a more dangerous situation because they were all waiting together. And that will be something that I asked them to add more personnel. So 2 things on the border openings, if it does happen, unless the lightning strikes from the White House, it would be 2 screenings, but more importantly, it will depend on every local community with the advice of CDC, with the advice of the local health department or doctors to say yes or no. And therefore, I think we can open the border safely. We've done it everywhere else except for the border, and we're hoping that we can do this in a safe way. So that is a quick summary of what I wanted to present, and I'll be happy to answer any questions that y'all might have at this time.
Thank you, Congressman Cuellar. We have a couple of minutes. Does anybody have a question for the representative?
I can go on, but I want to leave a few minutes to answer any questions if y'all have any questions.
Yes. Let me see.
This is Frank Fernandez.
Yes.
Representative Cuellar, thank you so much for joining us today. We've had questions on the chat line about efforts to intensify education, intensify advocacy, and address healthcare issues for the underserved. Can you tell us a little bit about what are the efforts in the Laredo area that could be a model for the rest of us?
Yes, sir. Well, first of all, I think that's UTRGV, is that correct? I'm trying to see your...
Yes, sir.
All right, well, good. And thank you for what y'all do, and glad we got that open down there some years ago with the help of Dr. Francisco Cigarro from Laredo, who was the chancellor at that time for UT. Look, healthcare is very important. In fact, I started when I was in the state level. I started the first CHIP program in the state of Texas at the Farias Elementary School, then co-sponsored the statewide program in the state of Texas. CHIP is very important. I voted for the Affordable Health Care Act, and as you know, it's been under attack, not only in the Supreme Court, but quite honestly through the administration. So, I want to make sure that we get more people that can decide what doctors they go to through that type of assistance. Community health centers, I put in I work with the appropriations to add billions of dollars to support them. Certainly on the medical education, I've been working to try to see if we can get more of those residents, that money in that area. So I added some language, working with the center to see if we can get more down to the valley in particular. And we're going to follow up on that. I know that I've worked with Renaissance Hospitals and other folks down there to make sure that we have residents. The other thing that I do want to say is that the state of Texas has left literally combined billions of dollars, not only from the CHIP, because we can expand the CHIP. The number one state is Texas in uninsured kids. We have left billions of dollars on the table because we're not expanding CHIP. Federal dollars have been left there. On the affordable health care, the state of Texas, as you know, decided not to go into the Medicaid expansion. So we lost the Medicaid expansion, billions of dollars on the table. So what we can do at the federal level is one thing, but we need state partners to expand Medicaid, which are billions of dollars that the state has left on the table, federal dollars, hundreds and hundreds of millions of dollars, but now billions of dollars on the CHIP expansion, federal dollars that the state has left on the table. And I think you all know this. I mean, I was at the state, I was in appropriations also, and there's always this concern about providing more money. And when I was there, chairman of the Public and Higher Education, we put more money in higher ed than any other time. But there's different leadership, and they think a little bit different. And as I said a few minutes ago, they have hoarded, and I use the word hoarded, billions of dollars of CARES Act 2, so they can use that money to fill in their gaps on their budget that starts next year in Austin. And I think that's wrong. It's wrong. It's totally wrong. We need the money now that we can provide to healthcare, to the schools of medicine. I mean, there's so many things we can do right now to our hospitals, to the clinics, but the state is hoarding that money to be used next session.
Thank you, Congressman Cuellar. Thank you so much for joining us. And I'd like to adjourn this session again by thanking everyone who participated. And we'll have to get together again soon. Thanks.
Thank you so much. Thank you.